Hi guys, welcome back to the channel. My name is Victoria Iwuji BSNRN, and you guys know in this channel that I talk about nursing, beauty and nutrition and other hot topics that I find interesting. I love to share with you guys. If this is your first time coming to this channel, thank you so much for stopping by. Please consider hitting the subscribe button below, touch the bell notification so you will never miss another video from me. And if this is not your first time, thank you so much for your support. Thank you for returning. Please consider sharing my videos, and I really appreciate your support. And in today's video, guys, we're going to be talking about pregnancy planner plus a healthier mom and baby to be. Yay! We all know what is pregnancy, right? Pregnancy is a period that a baby is developing inside the womb of a female or a woman. Pregnancy is determined by HCG. HCG is human chorionic gonadotropin. Okay, this is a pregnancy hormone that is found in the blood or in the urine. Okay, when a woman is not pregnant, that hormone does not increase. So the proof of pregnancy that you see on your pregnancy test, when you look at the strip, you said, oh, the pregnancy test is positive. So the difference between the urine of a pregnant woman and the urine of a woman that is not pregnant is the presence of this pregnancy hormone known as HCG, human chorionic gonadotropin. Okay, that's how you can tell that a distended belly is actually pregnancy. Another way to dictate pregnancy is by dictating the fetal heart rate, which is done by a healthcare provider. Uses ultrasound to confirm the fetal heartbeat. And also there's another device called Doppler. It's a handheld device that a healthcare provider can also use to detect the heartbeat of the baby. With that being said, it's really important to know that not everyone that you see with distended belly is actually expecting. So you don't really have to say congratulations to people unless they explain to you that they're really expecting, because your congratulations could actually be provocative. Okay, so we really have to watch out for things like this. So with that being said, I'm gonna share with you 12 goals, okay, of a healthier mom and baby to be. Okay, goals. The first thing you need to put on your planner is which goals to achieve first in life before having kids. What I mean by goals is education. Do you want to finish school first? Do you want to start working first? Okay, are you mentally ready? Are you ready to have kids? Do you know how many kids you want to have? Okay, these are the plans that you need to put down. When is the right time for me to get pregnant? Is it while I'm in school, or do I need to finish school? Do I need to start working first? Because financial independence is really, really important before bringing kids out into this world, because raising kids is not cheap. It's expensive to raise kids. Okay, you really need to know your stand. You really need to plan yourself so you don't really bring kids when you're not ready. While you're planning, you really also need to know which contraceptives work for you. Okay, if you cannot abstain from sexual intercourse, then you need to use condoms. You need to be on birth control, or you use condoms and you use it rightly and all the time whenever you engage in sexual activity. This way, you don't get pregnant before the time you're ready for pregnancy. Number 2 goal is to eat healthy. Eat a lot of fruit and vegetable. Make a colorful plate. Colorful plate means you have fruits, you have vegetables, you have grain, you have water. Okay, if you like to drink juice, try to switch juice with water. Try to switch juice with smoothies, green smoothies. Okay, eat healthy. Before you go to the grocery, write list of the items that you're buying and look at the nutritional contents of the food that you're buying. So to prevent yourself from making unhealthy choices when you're not home, it's really important that when you're leaving home, you pack up some snack. Snacking with what you have is going to prevent you from making unhealthy choices when you're not home. The third goal is to be very active. Exercise. When you're planning to get pregnant, it's really that you engage yourself in physical exercise. And if you don't have money to register in the gym, you engage yourself in moving, walking, walk around your neighborhood. Swim if you know how to swim. Run. Whichever exercise that works for you, make sure you engage in them. Do things. Be physically active. Don't live a sedentary lifestyle. Sedentary lifestyle is a lifestyle that you just eat, sleep, sit down, and don't move. Such lifestyle is not good when you're planning to be pregnant because you need to maintain a healthy weight. You also need to strengthen your muscles. The fourth one is to make sure you take your vitamins. You need prenatal vitamins that has folic acid. This one says with folic acid before and during pregnancy. So the reason why you need vitamins with folic acid is to prevent neural tube defect. Neural tube defect is the abnormality of the unborn baby's brain and spinal cord. You need to prevent that. If you don't have enough vitamins and folic acid, your baby is at risk for neural tube defect. Another thing is, if you are anemic, you need to speak with your healthcare provider so you can get prescription for iron supplements. You need iron if you are anemic to help your body produce enough blood so you can be able to supply your baby with oxygen. Number 5, you need to protect yourself from sexually transmitted infections. Oh yes, that's a big one. How do you protect yourself? By maintaining one sexual partner and also by being abstinent. Abstinence means staying away from sexual relationships. So it's really important that when you're planning to be pregnant, you maintain one sexual partner and you buy a supply of condom. Each time you're engaging in a sexual intercourse, you need to use condom and use it right. You can only protect yourself when you use it right and use it at all times. If you use it today and skip tomorrow, you are still at risk of, contacting sexual transmitted infections. So you really need to protect yourself. Have one partner and who has decided to, have sex with only you, and also have supply of condoms. This way you protect yourself from, getting infections that could affect your baby. There are so many infections that could transfer from mother to baby, which hepatitis B is one of them. Or hepatitis B can transfer from a pregnant woman to her unborn child. Number 6 is to meet your doctor for screening. You need to meet with your doctor because sometimes you could have these infections without knowing. If you have been exposed to them, please make sure you take the full dose of your medication. And when you're getting treated for sexually transmitted infections, your partner also needs to get treated. Because if you get treated and your partner don't get treated, you're gonna get reinfected again. And you both need to take the full dose of your medication. Compliance is really important. When you have a treatment plan with your provider, to be compliant with your treatment is the only way that you're gonna be successful with your treatment. Number 7 is manage, reduce your stress, and get mental health before you get pregnant. Stress is not good if you're trying to get pregnant or if you're pregnant. You need to reduce your stress. How do you reduce your stress? Being able to identify your stressor. What is it that stresses you? Know your limits. When your body is getting weak, learn how to pause and rest. Don't overwork yourself. When you're tired, rest. When you can't complete a task, rest. Because the more you force yourself to accomplish a task that you're not able to because your body is already weak for the day, then you're stressing yourself. So if people are your stressors, try to stay away from people who stress you out. Stay away from stressors. Anything that's gonna cause you to be stressful, stay away from it. Learn how to manage your stress by resting. Planning yourself well, organizing yourself is gonna help you to be less stressful. Have a planner. Know what to do. Know when to do it. Know when you're tired. Know when you can go further. When you are able to identify these things, you're going to be able to manage it. And you're going to be able to reduce your stress. Anything that's going to cause you mental stress, please stay away from it. Your mental health is really important when you're planning to be pregnant. Number 8 is to stop taking medications that are not prescribed for you. Oh yes. Ibuprofen, aspirin. It's really easy to say, oh, I have fever. You can ask your family member, do you have ibuprofen? Give me. Do you have aspirin? Give me. Because you know that these medications decreases pain and they decreases fever. These medications are known as NSAIDs. NSAIDs means non-steroidal anti-inflammatory drugs. They can cause stomach ulcer. They prevent blood clots. And any medication that prevents blood clots causes bleeding. So when you take these medications, you are at risk for bleeding. So that's why you cannot take any medication that is not prescribed for you. Your doctor needs to be the one to prescribe medication for you. They know your health history. They know the appropriate dosage that you need. Are you taking it from someone else? The dosage that the person is taking is what was prescribed for them and not for you. That's why you cannot be taking medications from people and, drinking it if you're planning to be pregnant. You need to be healthy. Everything that you need to be between you and your healthcare provider. Speak to your doctor. Doc, is it okay for me to take this? And see what they're going to tell you. Don't make decisions by yourself. Don't buy over-the-counter drugs because you don't know which one is going to cause you to start having internal bleeding. You don't know which one is going to make you to have stomach ulcer. Okay? Stay away from over-the-counter drugs. Stay away from medications that are not prescribed for you. Number 9, quit smoking. Smokers are liable to die young. And when you smoke, you're destroying your lungs. If your lung is damaged, how are you going to breathe? If you are not breathing, are you still alive? The answer is no. Breathing is really important. And smoke from cigarettes, okay, damages your lungs. That's not good for you. That's not good for the baby. Being a secondhand smoker also is not good for you. Being a secondhand smoker is when you inhale smoke from people who are smoking. So if you're planning to be pregnant and you have people that smoke around you, please get up and move. When they start smoking, stay away from them so you don't inhale. And sometimes you actually inhale it on the street. People are smoking and you're passing by and you inhale. So you really have to be watchful when you're walking on the street. People are smoking, people are standing there smoking. You can walk faster and move. If you can cross over to the next street, anything that's going to prevent you from inhaling smokes. Okay, if you have a partner that smokes, speak to them. Whenever they want to smoke, they can step aside and don't smoke where you are. Or if they don't want to step aside, you can step out, okay, while they smoke. Because smoking is not good for you. It's detrimental to your health and it's not good for the baby. Number 10 is to quit drinking alcoholic drinks. There is no amount of alcohol that is good for you and for the baby. It can cause fetal alcohol syndrome to your child. You're planning to be pregnant, or as soon as you find out that you're pregnant, the best time to quit is today. Number 11 on your planner should be to manage your health conditions. If you have asthma, you need to manage your asthma. If you have diabetes, you need to manage your diabetes. If you're overweight, you need to manage your overweight. But you could ask me, how do you manage your asthma? How do you manage diabetes? And how do you manage your overweight? There's you can Google American Diabetes Association. Okay, you can Google search that. American Diabetes Association. Go to the website, read up about your health condition, how to manage it, okay? How to take care of yourself. With the information you get from the website and the information you get from your doctor is going to be able to help you. If you're asthmatic, you need to Google the Asthma and Allergy Foundation of America. That website is going to teach you a lot about your health condition. Okay, I'm going to put all the information on the description box below. Read up about your health condition, know how to manage your health, know what to do, know the questions that you can ask your doctor when you go for your next appointments, know the signs and symptoms to look out for. Manage your health well. You need to know how to manage yourself before you can be able to manage the baby. If you're overweight, you need to Google Office of Disease Prevention and Health Promotion, Healthy People 2030. Read up about weight. Read up about information on obesity, how to manage it, healthy living, exercise, eating green leafy vegetables, fruits, decreasing sugar, drinking a lot of water, running, walking, okay? Those things is going to help you to manage your health problems or your health conditions. And number 12, and the last, is to learn your family history. Because most time when we receive patients in the hospital or in the clinics, one of the assessment questions that we ask is, do you have family history of diabetes? Do you have family history of seizure? Do you have family history of hypertension? And most times patients answer, no, 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 no. and they don't even know the family history. How do you know your family history? By asking mom question, ask dad question, speak to your aunts, speak to your uncles, speak to your cousins, speak to your nephew, speak to grandma and grandpa. What health conditions do we have? Do we have anybody in the family that have suffered from cancer? Do we have anybody in the family that have suffered from hypertension? Do we have anyone in the family that has diabetes, asthma? What do we have in our family? You need to learn about this health condition. So when you go to speak to your healthcare provider, you're going to be able to give them the appropriate information so they can be able to determine how to help you and what to look out for. So these are the 12 goals for a healthier mom and babe to be that I want to share with you guys, because a lot of people do ask me, oh Victoria, when did you start having kids? Or when did you know that you were ready to start having kids? I don't think I'm ready. I don't know what to do. That's why I decided to come up with these videos to share with you guys what to do, how to do it, especially when it comes to exercise. You really need to exercise. I get a lot of talks from friends, neighbors, co-workers. Most of them will tell me, Victoria, oh, I have treadmill, I have stationary bike, but I don't have time to exercise. And most of you guys, you are subscribed to this channel, and you can bear witness that my answer to you at all time is to start small. And what I mean by starting small is start with 10 minutes of exercise a day. If you have a treadmill, exercise on your treadmill 10 minutes. Only 10 minutes a day. If you have the jumping rope, jump only 10 minutes a day. So the moment when you start jumping 10 minutes and you start getting used to it, you're going to progress to 15 minutes. And you're going to progress to 20 minutes, 25 to 30. At least the goal is to make sure that you exercise at least 3 times a week. The ideal is 3 times a week, 30 minutes each. But 30 minutes could be really challenging to a busy mom. It could be really challenging to someone who has a busy lifestyle. When you're busy, you work, you school, you are engaged into so many activities. Involving yourself into physical exercise could be really challenging. I know, because I am involved into so many things. I'm a mom, a wife, I work, I school, I do so many things. So it's not easy to keep fit. Okay, so what I do is to squeeze out 10 minutes. Out of my 24 hours a day, I managed to squeeze out 10 minutes. How do I squeeze out that 10 minutes a week? So the days that I'm working, if I need to exercise, for example, if my wake up time is 6 o'clock in the morning, for example, so instead of me waking up 6 o'clock, I'm gonna wake up 5:50. So when I wake up 5:50, I do 5:50 to 6 o'clock. I set up alarm on my phone. Only 10 minutes is not gonna pass 10 minutes. The goal is not to lose weight. I've already achieved my ideal weight. Honestly, I'm not exercising to lose weight. I'm just exercising to keep fit. I'm exercising to maintain what I have so I don't start gaining. So I do only 10 minutes in the morning, because if I don't do it in the morning and I go to work and come back, forget it. After 12-hour shift, I am not coming back home to do nothing. I am tired. I am weak. All I can see is my bed. Okay? So thank you so much for watching my video. I wanted to share with you guys this information. Okay? Thank you for watching. Share my videos, and good luck as you plan with your pregnancy. Please keep this pregnancy checklist and goals. Keep it handy. Make sure you look at it. Make sure you refresh your mind with it. Okay? Keep up with your goals. And good luck with your plan. And as you plan to welcome your baby soon, congratulations in advance. And I see you in my next video. Share with your friends. Share with your loved ones. As always. Bye.